Assalamu alaikum. Why do some people get ICU care and others don't? Most people who get coronavirus will inshallah recover at home over a few days without any special treatment. However, some people need admission to a hospital ward, and of these people, some may need admission to an intensive care unit or ICU. ICUs are special hospital wards for people who are very ill, where it is felt that ICU support will allow a good chance of recovery. The types of people that are usually admitted to ICU include those who have had a serious accident, major surgery, have a serious infection, or failure of major body systems such as the heart, lungs, and kidneys. ICUs are able to carry out more intensive monitoring and high levels of medical support, including dialysis, artificial breathing support with a tube down the throat, and strong medicines to control the blood pressure. However, these treatments come at a cost. They can be extremely uncomfortable, and people will often need to be artificially put to sleep or sedated to tolerate the intensive medical care. In addition, the treatments do not guarantee survival and may just end up lengthening the time that a person spends slowly dying. People who do survive can be left with long-term problems afterwards, including problems with memory and the ability to talk, loss of independence, lower quality of life, and even needing breathing support long-term if their lungs are not able to manage by themselves. For people who are normally frail and already have serious medical conditions, even with ITU care, their chances of recovering are very low, and their final days would be spent receiving treatments that are difficult to endure whilst they are separated from their loved ones. It is for this reason that not everyone will be offered intensive care, even if they are getting so sick that their life is under threat. ICU doctors are highly experienced clinicians who will be honest about a person's chances of recovery. If the chances of recovery are considered reasonable against the level of discomfort caused, intensive care will be offered. However, if admission to ICU is highly unlikely to be successful, this will not be offered, regardless of the wishes of the patient or family. Medical teams are not legally bound to provide treatment that they do not feel will be in the best and overall interests of a person. These discussions and decisions are incredibly difficult for everyone involved. However, it is important to be mentally prepared for the possibility of this situation happening. In Islam, whilst there is a very strong position of sustaining life where possible, scholars have considered the question of whether all treatments, regardless of their chances of success, should be undertaken. We know that many of the companions of the Prophet, peace be upon him, refused active therapies in their last illness as they felt it would be futile, such as Abu Bakr as-Siddiq and Mu'adh ibn Jabal. Generally, scholars accept that at the end of life there is no obligation to undertake treatment which is futile. As Muslims, we place our complete trust in Allah's decree that arises from His wisdom. We accept that when Allah wills good for a person, He subjects him to adversity, Bukhari, and we continue to have a duty to honour and uplift the dignity of a human being until the very end of his or her time on this earth. In the end, for some, receiving ICU care is a blessing since they may recover. For others, not getting ICU care is a blessing since they will get to spend more time with families and be more alert in their last days. In both cases, life and death are in the hands of Allah subhanahu wa ta'ala regardless of ventilators, ICU or medication. Remember that and know that Allah has chosen the best path for you wherever it leads.